Good evening. Welcome to SpectraCell's webinar program. Tonight, we kick off the series with T-cell function, Unlocking the Secrets to an Adaptable Immune Response, presented by Dr. Ron Grabowski. A copy of tonight's slides, along with the on-demand recording, will be available on our website and YouTube channel as early as next week. Should you have any questions, please note the Q&A icon at the bottom of the Zoom window. We'll reserve the last few minutes of the presentation to answer any questions that come through. Without further ado, I'd like to welcome Dr. Ron Grabowski.
Thank you, Alyssa. Good evening, everybody. As you know, in the last 2 years, we've all been hit with this pandemic of COVID. And this evening, I'm here to show you some evidence of and the importance of nutrition and how it plays a role with our immune system and why it's so important that we once again consider that. And of course, the T cell is a huge player in today's immune system, and I'm going to show you specific nutrients that affect the T cell. You know, if you look back, we're really coming around full circle now with healthcare. If you go back to Hippocrates, where once again he said, "Let food be thy medicine, medicine be thy food," and then of course, in the 1700s, we discovered the vaccine for smallpox, and of course, you look at Thomas Edison, where once again, he talks about the future medicine will involve diet, will involve exercise, the frame, and so on. And so the new doctor of the future is really going to have to be aware of dietary changes, individual nutritional implications and how they come into play. And also with all the medicines today, how are the medicines affecting our nutritional status? And once again, if we don't take a certain nutrient, is that going to affect the way medicine works? And by the end of the presentation, I think you'll see that it definitely has a strong correlation. One of the things I always hear from my patients is, well, Dr. Grabowski, what affects my immune system? Well, you can see this is a great schematic out of the Journal of Nutrients in 2018, showing you various things that affect it. Everything from a stressful lifestyle, of course, poor diet like fast food, people sitting around, people getting obese, physical stress. We'll talk about exercise and how exercise at a certain level enhances our immune system. But if we go too far with exercise, where it will actually make our immune system compromised. Then, of course, things like alcohol consumption and smoking and so on. One of the things I often hear from people that try to take control of their health is they'll say, well, I think I eat healthy, I exercise, but I still get sick, or I still have this problem. Why is that occurring? And once again, I'll show you in regards to the immune system how that comes into play. Now, just a general overview and basic things about immunity, of course, is we have two major types of immunity. We have innate immunity and adaptive immunity. And I'll give you a brief overview of this. And once again, here's a schematic showing you the different types of immunity, where we have the physical and biochemical barriers on one side with the immune cells. And then, of course, we have on the right side of that, the innate immunity and the adaptive immunity. But if you go down to the bottom of this particular slide, you will see that there are numerous nutrients that come into play, whether they're vitamins, whether they're minerals, or even other things like omega fatty acids that come into play. The point is this: there is no one vitamin or mineral that does everything. There's nothing that we can say, oh, you only need to take vitamin C or you only need to take zinc. And that's why the importance of diagnostics is really comes into play. And you have to look at it as, how, you know, one person may be getting sick a lot and they may be vitamin C deficient. The next person may be zinc deficient and so on. And can we set off the immune system? Can we get to the autoimmune phase in some of these individuals as well? And that's where it comes down to what we call modulation. And you will hear me talk about that throughout this evening, about the modulation of the immune system, because people will go to their doctor and say, well, I was diagnosed with an autoimmune disease and we want to kind of suppress that immune system. And they don't realize that when you give nutritional support, it often modulates the immune system. So it doesn't enhance that problem. It actually tries to put it back into play. You can see by looking at the types of immunity, whether it's the innate or adaptive, we have certain cells and certain things that help protect us. And once again, I'll mention that this evening. So when we talk about the innate immunity, this is what we call the early warning immunity. This is the one that we're born with. Of course, there's no specific recognition. This is not the one that involves the antibodies. We'll talk about that later. But there are physical barriers that we look at. There's chemical barriers, there's a mucus in the respiratory system, in the GI tract, and so on. If any one of these are disrupted, our immune system starts to get affected. As you know, you probably have heard this, that the GI tract is the largest immune system of our body. And that's so true, because if we don't keep that GI tract healthy, we're going to cause other problems in other systems. There's a lot of research out there today showing that people that have GI problems have cardiovascular problems. People that have GI problems have brain issues like depression, anxiety, irritability, ADD. So this is one system we want to keep healthy, and nutrition is the major player, because in our GI tract, we slough off our epithelial cells every 3 to 7 days. So we have to repair those cells on a regular basis. And once again, several things particularly affect that. And these are some of the things we talk about. When we talk about the adaptive immunity, this, of course, is the one that's specific. This is the one that looks at the T lymphocytes. And of course, that's the cells that SpectraCell evaluates when they do that testing. And then we also look at the B lymphocytes. So these two are married to one another. They're very closely connected. And depending upon what the T lymphocyte status is, it will affect the B lymphocytes and so on. It's highly involved with the lymphatic system. And once again, these are the ones that help produce our antibodies. And these are the ones that control that particular function. And so going back to the innate immunity, showing you some external barriers and then showing you some chemical barriers. I want to talk about some of the chemical barriers for a minute here and how these can affect, because towards the end of this talk tonight, you will hear me talk about some medications that can highly affect your immune system, and you might not even realize that. So the pH of our skin, the pH of our blood, the pH of our GI tract is very, very important to us. And we've seen that in some of the research now with COVID, that certain nutrients change the pH of a cell. And if the pH of that cell is abnormal, then the COVID can proliferate or increase in number. Well, in regards to the digestive tract, starting with the stomach, you can see that we have a very acidic GI tract in regards to the stomach. If we change this with medications, whether it's an antacid, whether it's proton pump inhibitor, whether it's an H2 histamine blocking agent, we will affect this, and that's part of our immune system. So when we take in food, it has viruses, it has bacteria in it, it might have some fungus. No food is sterile. So how do we knock down those numbers of viruses and bacteria and so on to help prevent us from getting food poisoning every time we eat? Well, our gastric juice, our pH, our hydrochloric acid, those particular things affect our immunity. So if people are changing those particular barriers or particular factor, we're going to get sick. There's studies showing that medications like your proton pump inhibitors, which I'll get into further in the latter part of this lecture this evening, talking about how you can increase the proliferation of Clostridium, a very bad organism that can cause serious problems, can cause sepsis. But you can disrupt what we call the microbiome, of course, the balance of our bacteria. There's certain nutrients, if they're low, they're going to affect that as well. So people say, well, I take a probiotic, I think that's going to help my GI tract. Well, that sounds good, but it's not that simple. You'll see where I talk about B2, I talk about vitamin D and things like that. And if you are low in any one of those, that you can affect your probiotics. So going on to the second line of defense, you can see things like interferons, the complement system, and iron binding proteins. All of these, once again, come into play. The ability for the lymphocyte, the macrophages, your neutrophils, your various white blood cells to work efficiently is based on your nutritional status. There is a lot of information going back numerous decades that support that. If you look at towards the bottom of this particular slide, you will see that ferritin comes into play. So iron is very important for the immune system. On the other hand, if you have a bacterial infection and you give too much iron, it may actually proliferate that particular bacteria. But on the other hand, if you're low in iron, you're more prone to bacterial infections. So there's a fine measurement there that we have to look at to make sure that we have adequate amount. And in some cases, we don't give too much of one nutrient because it may actually make the condition worse. And then there's other nutrients that, once again, come into play that complement that as well. Then we look at natural killer cells. This is a very interesting cell. As you can see, it's makes up about 5% of the lymphocytes in the blood. Natural killer cell has several functions. You'll see that in a minute. But once again, it's highly affected by certain nutrients. Selenium is one that affects it. Zinc's another nutrient that affects it. Vitamin A is another one that affects it. So this is a type of cell, of course, that we want to have adequate amounts to be able to fight certain things. And once again, you will see in a little bit on what nutrients affect that. When we talk about bacteria, we often talk about white blood cells that are phagocytic, and we talk about macrophages, we talk about neutrophils. And those particular cells have these particular phases. There's a little alarm system that goes off telling the body, oh, there's something wrong here. The neutrophil comes into play at that point, and that's called chemotaxis. Then once that particular neutrophil comes in contact with that bacteria or some other foreign material, it adheres to it, then it engulfs it, and it allows it to ingest it and then digest it and eventually kill that bacteria. So there's 5 steps that have to occur. There are nutrients that if you're low in, these steps are inhibited. So for example, if you're low in vitamin C, that your ability to set that alarm system off to let that chemotactic factor come into play to recognize that there's something out there that's bad, your body doesn't recognize it. And we see that a lot in people that are diabetic. You often hear people say, oh, if you're diabetic, you're going to heal worse or you're going to be sick more often. So there are physiological, biochemical, and nutritional factors that allow that to happen. If you are deficient in vitamin C and you're diabetic, your chemotactic factor is affected. If you have low protein or if you don't have enough zinc per se, you can't make certain enzymes in the cells like the neutrophils, and so you can't digest it. So this cell, the neutrophil, may engulf that particular bacteria, but the ability to kill that by digesting it is inhibited or delayed. And so these bacteria start to multiply more and more, and of course it gets you into trouble. And that's what's really important to remember. And that's why there is not one single nutrient that does all this. And you'll see that as we go on. Then, of course, as I mentioned, besides the innate immunity, there's adaptive immunity. And this is split into 2 different types. It's called cell-mediated and there's antibody-mediated. And of course, the antibody-mediated is the one that a lot of people are talking about today with COVID. Of course, we get the virus, we produce hopefully enough antibodies to fight that particular virus. Now, we can't do that without the ingredients. It doesn't just happen. If you're deficient in certain nutrients, which I'll show you, you are going to have a problem producing antibodies. There's some research out there showing that people that are deficient in certain nutrients, that even when they get a vaccine, whether it's the influenza vaccine or some other vaccines in the past, that their ability to produce antibodies against that, to produce those memory cells that help, once again, fight that virus once it comes in again, are inhibited. It may be inhibited by as much as 75%. So just because you're going out there and getting a vaccine doesn't mean you're fully protected. And we hear that all the time where people say, well, I got the flu vaccine and I got the flu. Well, there's a lot of variants. There's a lot of mutations with the flu virus, just like there are coming out now with COVID and so on. So how does the body adapt? The body adapts by being able to produce antibodies against that particular mutation. And once again, that does that through nutrition. So this particular immunity, adaptive immunity, is what we call this. It's very specificity, and it also has a memory. So that's why when you get a vaccine or when you get sick and you hear about herd immunity, why, when I come in contact with that virus again, do I not get sick, or do I not get sick as poorly as I did the first time? Is because your body was able to make antibodies to remember that particular mutation. But once again, that does not occur without nutrition. And so that's what's so important. So you can see here, cell-mediated immunity, and this is probably a review for the majority of you out there, is directly attacking invading antigens. Where the antibody-mediated immunity, this is where you're producing the antibodies and also, of course, known as immunoglobulins. So the cell-mediated immunity, these are the things that it can go after. It can go after viruses and bacteria, fungi, some cancer cells, and even other foreign tissue that are involved with like transplant. As you notice, special notation here, it always involves cells attacking cells. So one cell is going after another cell to kill it. On the other hand, when we talk about antibody-dependent immunity, we're talking about outside the cell, and this is where it's put into the antibody regimen that everybody talks about. Now, if it involves the lymph or the blood, that's also known as humoral immunity. So once again, we're involving a fluid that is allowing that to happen. And these are the antibodies, once again, that you notice. You can see the IgG, it's the one that crosses the placenta first, it's the most abundant, it goes all the way down to the IgE, where people talk about the mast cells. But if you look at next to the mast cell, you see that blood cell, basophils. Basophils are very low in number, but once again, they produce serotonin, they produce histamine. And then to keep that in balance, we make a cell called the eosinophil that makes histaminase that more or less degrades histamine. So we have a basophil that produces histamine, which is good to some degree as long as it doesn't get too large in number. And then we have another cell that more or less keeps in check called the eosinophil. But those enzymes, those products cannot be made without, once again, adequate nutrition. We don't just say, oh, our immune system's going to be good because, you know, I'm 22 years old, I eat healthy, and so on. No, there's several things that can come into play. So once again, as I mentioned, the innate immunity is your fast-acting immunity. It's the one that doesn't have any memory. It's the one that involves your neutrophils and so on. And you can see here, there's several things listed that this vitamin C does. And so when people say, well, does vitamin C really help with the flu? Or does it help with the cold? Does it help with your illness? Does it help with bacterial infections? Yes, it does that through supporting the cells that either produce antibodies or once again, produce enzymes, or that chemotactic factor where I mentioned where it sends a signal out and says, hey, there's something wrong, attack. And once again, that only occurs efficiently if you have a vitamin C adequacy. It also can increase antibodies. It also can stimulate that. Once again, the lymphocyte, of course, the title of this particular webinar, the lymphocyte is very, very important to us for antibody production and for signaling, for T helper cells and so on. We can differentiate, we cannot proliferate those cells without vitamin C. So once again, so if some of you have used SpectraCell and then the micronutrient test, and you say, you know, I did that with a patient and the patient's test didn't go through, it may be because their cells are so weakened, so damaged that when SpectraCell tries to stimulate that proliferation, the vitamin C might be so low in those particular cells that you can't get that proliferation. And we've seen that. We've seen that when people are low in certain antioxidants that fails. Now that's very rare. It's like 1% of the tests, maybe 1.5% of the tests that occurs. But the point is that it's highly dependent upon what that patient's cells have as far as content. Vitamin D, probably the #1 nutrient that people are hearing about today. You want to make sure your vitamin D is good for your immune system, especially against viruses. Well, it also has a benefit with the innate immunity. It also has effect with the monocytes and the macrophage. You know, we hear about cytokine storm, where people are getting this inflammation of their lungs, and that's what's caused them to get really ill or cause inflammation of the heart or the GI tract, whatever. But we get these cytokine products produced. Well, the ability to make those and keep those in check is highly dependent upon vitamin D. And so once again, it's something that we look at. And you can see it talks about the bacteria as well. Well, if you have a vitamin D deficiency, as it says here, you can see it suppresses antibody production by the B cells. And it also affects the way the T cells proliferate. So your adaptive immunity, in addition to your innate immunity, is affected by vitamin D. Now, depending upon who you read out there anywhere from 65 to 85% of the population is vitamin D deficient. And we know vitamin D deficiency increases during the winter time because people are outside less. Or we also know that there's an issue with vitamin D in certain ethnicities like Hispanic and African American, or people that have darker skin, because that's kind of a sunscreen for them and it doesn't allow them to produce vitamin D. And you hear it talking about ethnicity, like you hear sometimes that in the news that the African American suffers more with COVID in some cases than Caucasian. Well, they also have a higher incidence of vitamin D deficiency. So it goes back to nutrition when we look at this. Now, these are some factors, and this was a great article published in Antioxidants in September of 2020, showing you how vitamin E has a role. It has an effect on mitochondria, viral replication. Of course, that's one of the main things that we want to inhibit, is we don't want that virus, the COVID, to get into the body and start multiplying. And you can see the cytokine storm is up on there on the list as well. So if you have a vitamin D deficiency, you're going to affect certain parts of the cell. You're going to affect the way a virus attaches to a cell and proliferates and penetrates. And once again, do we wait till say, oh, wait until we get sick and say we better do something about it? No, it's all prevention. And that's what I was showing you on the very first slide, is the doctor of the future has to look more pro-preventative. I mean, we need to be preventative rather than reactive. And in the past, I think more people have been reactive. Here's another schematic, same, once again, citation, where you can see how, once again, the renin angiotensin system's involved and vitamin D is involved in the whole thing with SARS, and how oxidative stress, that's the inflammatory process, that's where we have damage, that's where the free radicals come into play. But one of the things, one structure that we always watch very closely, and we have to be very aware of, is of course the mitochondria. The mitochondria, as you know, we've all learned this in school, that's the powerhouse of the cell. We have to keep that healthy. And they've shown that mitochondrial dysfunction occurs with vitamin D deficiency. And that's why so many conditions out there are known in this. And we'll talk about vitamin D when we get to the athlete this evening, and showing you that that's something that happens with a lot of athletes, is they become vitamin D deficient. And then in the middle part of the season, or the latter part of the season, they start to get sick, or they start to have muscle damage. They start to have problems with healing. And it's not just by chance that that occurs. It's happening because they're depleting themselves of a certain nutrient, or they were depleted and now it's finally kicking in and causing some major problems. Here's a little schematic, and this was once again a great article that came out of PLOS Pathology in 2020, showing you kind of the relationship of vitamin D and the benefit of vitamin D and the vitamin D receptor and how that comes into play. And there's some people, as you know, out there that have vitamin D receptor mutations. And so some people may be taking 5,000, some people may be taking 1,000, some people may need 20,000 a day to really modulate their immune system to prevent some of these things from happening. And on the bottom part of this slide, you will see how some of these things are being affected specifically. And there's some beautiful research. Some of the researchers out there have done a beautiful job on individualizing what particular parts of the immune system may be affected or have been affected when we have a vitamin D deficiency. And once again, it affects both. It affects the innate as well as the adaptive. And this is where people thinking that they eat healthy isn't good enough. It's like I tell patients all the time, you sit in front of me, I'm doing an exam on you, but I can't look through your skin and say, oh, your cholesterol's high. We have to do diagnostics, looking at cholesterol and seeing if you're predisposed to cardiovascular disease is no different than looking at vitamin D deficiency and seeing if you're prone to immunological problems or other problems down the road. For example, vitamin D deficiency has been highly correlated with diabetes. It's been highly correlated with certain autoimmune diseases. So when people are low in vitamin D, it's not just the fact that they may get a viral infection and get sick, or a bacterial infection. They may get an autoimmune disease. They may turn on a gene, or they may get something like diabetes. because vitamin D helps maintain the pancreas. It affects the insulin receptors. So we see this a lot with individuals that one, they might get sick and then all of a sudden they get diabetes, and doctors don't put it together. They don't see that there was a correlation there, and it could be a strong correlation with vitamin D. Now, as I mentioned, there's no one nutrient that does everything. And there's a lot of nutrients that play a significant role with another. And this is a great slide. This was actually in the Journal of, once again, Advancement in Nutrition in 2014, where they showed where FAD, where I circled FAD here. FAD is an enzyme that is associated with riboflavin. And the purpose of this slide is to show you how riboflavin plays a role in making vitamin D. It also plays a role in cholesterol regulation. So here's a B vitamin that is playing a significant role biochemically and physiologically with a fat-soluble nutrient. So by just thinking that you're taking vitamin D, or think you're going to synthesize vitamin D because you're getting sun, well, what happens if you're riboflavin deficient? It's not going to happen. And so this is a very important role, showing you how a water-soluble nutrient like riboflavin is affecting a fat-soluble nutrient. Here's some other research that's very interesting about riboflavin and how riboflavin affects the macrophages and how it affects the cytokines. Like I said, if you have a riboflavin deficiency, that they've actually shown that you are more likely to increase your pro-inflammatory cytokines, primarily tumor necrosis factor alpha and interleukin-1 beta and interleukin-6. And this has been known, if you look at the citation, this has been known, 17 years, 18 years ago in the bottom citation. On the top citation, it's been known for 6 years, so it's been supported. And so this is very important to keep in mind, that it's the combination. It's like I tell my patients all the time, if you're going to make a cake and it takes 12 ingredients to make the cake, I can't give you 2 ingredients and make the cake. I don't care how good a baker you are or how good a baker you have to have all 12 ingredients. And that's where the synergism of the immune system and of nutrition is so important. Now, vitamin A doesn't get talked about a lot, because a lot of people, the only time it usually gets talked about is, it can be toxic because it's fat soluble and build up in your body and so on. But if you go back, way back into immunology and vitamin A, you will see it has a huge role in both innate and also the adaptive immunity. And so once again, those little cells I was telling you about that line the digestive tract, those little cells that line the respiratory system, the bronchi, they're called epithelial cells, as all of you know. And if you're not a clinician, you might not be familiar with those, but of course, if you're a clinician, you're very familiar with it. We cannot replicate those cells without vitamin A. And you can look here about the natural killer cells. Natural killer cells, as well as macrophage neutrophils, don't function well or don't get produced if we don't have vitamin A. Some people say, well, how much vitamin A, or how do I know if I have vitamin A? You have to do testing. Once again, there's no way that anybody, any clinician, I've been doing this for over 40 years. There's no way that I can look at you and just say you're vitamin A deficient. Yes, we can do these questionnaires and things like that and maybe predict that you might be low in that, but why guess? I don't want anybody guessing on my health, and the clinicians out there, I know aren't going to guess on your patient's health. And so that's very important. Have some objective data. Here's vitamin A and the adaptive immunity. Once again, talking about the T and B lymphocytes and how important it is. There's been some really early research done showing that when people don't have adequate vitamin D or adequate vitamin A, that if they do get a vaccine, that they don't get the full benefit of that vaccine. And you can see here that vitamin A is important for T helper 1 and T helper 2. And once again, it has these anti-inflammatory effects. We always talk about the immune system, but I think people disengage themselves from realizing that that immune system is only as good as your nutrition. It's only as good as your nutrition. And that's the whole point of this talk this evening. Vitamin E, once again, another fat-soluble nutrient, primarily known as a strong antioxidant. A lot of people don't really relate this much to immunity unless you're in this field and you know that. But if you go in the literature today, the scientific literature, you will see that there are several articles talking about vitamin E importance against, once again, viruses. And it's, of course, in the last 2-3 years, talking about COVID. And it's one of the top 5 or 6 nutrients that people talk about. They talk about selenium, they talk about vitamin E, they talk about vitamin D, zinc, and C. Well, once again, here's another indication that it helps natural killer cell activity, it makes it more efficient. So one of the things we have to realize is we may have some neutrophils in our body. I'm just going to use this as an example. And when neutrophils go to kill a bacteria, they produce free radicals, and that causes inflammation, that causes tissue damage. So if I have a really high quality neutrophil, and it goes into an area that has a bacterial infiltration, and I only need 50 of those neutrophils, I'm going to produce less inflammation from the breakdown of those neutrophils because they're more efficient. If those neutrophils are only working at 25%, and now I have to send in 4 times the amount of neutrophils into that area, what am I going to do? I'm going to cause more inflammation, I'm going to cause more free radicals, and so on. So we want our cells to be as efficient as possible, and that's really what we're trying to say. And once again, here's your vitamin E in the T cell, talk about the T lymphocyte and T helper 1 and 2, and how it really helps modulate those particular parts of the immune system. B6, once again, some people talk about this or they're aware of it, but like I said, if I gave a little questionnaire to most of you, unless you've been in this field for a while, and I said, tell me nutrients that are effective with the immune system, not maybe a lot of you would pick B6, or the public probably wouldn't talk about B6, but once again, B6 is very important, as you can see, for cytokine control, natural killer cell activity from the innate immunity standpoint. From the adaptive, it is huge with the lymphocytes, very, very important. It has a very strong role with antibody production. So once again, now, something for you to think about, this is how dietary factors can affect it. If any of you are prescribing gluten-free diets out there to patients, and once again, there's a role for those gluten-free diets. Gluten-free diets have a tendency to push a patient into B6 and selenium deficiency. So in essence, if you didn't know that or you weren't testing for that, you would be putting this person on a gluten-free diet, and yes, their GI conditions may be feeling like they're getting better, but indirectly, you're pushing them into B6 deficiency, and now you're affecting their immune system. And that's where the future antibody production and other things are going to be affected. So once again, you will not know that unless you have some type of testing. B12, of course, everybody thinks about B12 and energy, red blood cells, but not a lot of people talk about B12 and the innate immunity. And once again, one of the roles that it has is it helps with the natural killer cell function. From adaptive immunity, once again, you can see here, we talk about the T lymphocytes. So any cell, we know any cell to be replicated needs RNA and DNA. And once again, B12, folate are highly associated with that. So we need to make sure that those nutrients are very plentiful or adequate. I'm going to give you a little insight now, but I'm going to talk about it more at the latter part of this webinar. Is B12 is highly affected by medications that we use for the stomach or for esophagus. So when we recommend H2 histamine blocking agents, or we recommend proton pump inhibitors, we are going to affect that. If people are strict vegetarian and they're not taking a supplement, okay, once again, or people have a chronic history of gastritis, or a person might have, a history of H. pylori. Any of those things are predisposing us to B12 deficiency. And once again, as I mentioned, B12 and folate are major players for RNA and DNA replication cells. And what did I say about the GI tract cells? They replicate, or we need to replicate them every 3 to 7 days. That's in a healthy GI tract. Now, if they have an underlying condition, they may need to be replicated every 1 to 2 days or 1 to 3 days, but you can't replicate them without the material or the ingredients. And once again, that's important. So here we come into play with folate. Well, some of you, maybe all of you, are very familiar with the methylation pathway. And once again, if you haven't tested your patients on the MTHFR, this is something that I highly recommend, especially if they have immunological issues. even if they don't have, but it's something important to know. But here's another case where a person may be taking folic acid instead of methylfolate, and they think, oh, I'm taking this B complex, it has 400 micrograms of folic acid, I'm covered. No, if they have a methylation problem or mutation in the MTHFR, you know that might not be adequate. And once again, it starts to affect the immune system. So this goes back, once again, that there's no one vitamin or mineral that's going to take care of the immune system. It's a conglomeration of nutrients that we have to support, and then there's a balance, and we'll talk more about that in a little bit on how one nutrient may cause a problem with another, or as I showed you earlier, vitamin D. If you don't have adequate riboflavin, you don't make vitamin D. I haven't even talked about microbiome yet, but I will talk about microbiome this evening with vitamin D status and how that comes into play. If you talked about immunity, most people, if you went out to the public and said, person's sick, what do you give them? Oh, I give them vitamin C, or I give them zinc. Everybody's well aware of zinc and the importance of it, but they might not know the specifics of it. The beauty of zinc, once again, is it affects both the innate and the adaptive, but it has several other functions out there that help us on a daily basis. There's over 300 functions we know that zinc has that, once again, come into play. It affects the pancreas. It affects our GI tract. It affects serotonin levels. It affects dopamine. There's several things that it affects besides supporting our immune system. So once again, when people get sick, if they're kind of depressed or they're depressed and then they get sick, is there a common function there or product there that may be doing it? Of course, it could be zinc. It could be zinc is low and it's causing a low serotonin level, and then eventually they get sick. And of course, that's because the innate as well as adaptive immunity is being affected. So you can see here at a very bottom bullet, I think it's very important that I point this out, that zinc represents almost 10% of the human proteome. And once again, this trace element, this mineral, has a huge effect. And the last word is important to remember: immunomodulation. So it's important that we modulate our immune system, because once again, if that immune system gets out of its normal modulation, what do we get? We get an autoimmune disease. But this is why people that have autoimmune diseases, when you put them on zinc, if they need it, how you can modulate the immune system back. And I have case after case in my practice, and other doctors I've talked to deal with that. Now, there's once again relationships. Zinc, we always say, don't ever give zinc without copper long-term, because if you give zinc and you don't give copper, you cause a copper deficiency or vice versa. And you can see how copper has some roles as well. It's antimicrobial. It also accumulates at sites of inflammation. It makes, once again, antioxidants involved with what we call superoxide dismutase, but it has an effect on, once again, bacterial infections. So if people are just saying, oh, I'm taking a zinc lozenge every day, or I'm taking 3 or 4 of them every day, 6 months, 9 months, a year down the road, they may get sick more often. They go, I don't understand. I've been taking zinc and it's making me sick more often. I was less sick when I didn't take zinc. Well, you might have caused a copper deficiency. And once again, this comes into play with balance. It's all about balance, equilibrium. Every one of us in school, when we're going through our classes, especially maybe our first biology class or first physiology class, we heard this term homeostasis. And that's really what it's all about, is are we getting our body or maintaining our body at a homeostasis type of status? Every one of us is different. There's not any one of us out there in the world that has the exact same biochemistry. So why do we treat people the same? Oh, you're sick, take 500 milligrams of vitamin C 3 times a day, take 30 milligrams of zinc twice a day, and we think that's going to correct it. Once again, as I mentioned, they might not need vitamin C, they might not need zinc, they may need vitamin D. So we need to look at that. This is a nutrient that's definitely well published out there, especially with relationship to viruses and COVID today. There's articles published in 2020, 21, and even now in 22. And we talk about selenium. And selenium, once again, has a role, a very strong connection with natural killer cell. And even though it only makes up about 5% of the lymphocytes, it's very important. And there's a lot of different functions. But once again, as I mentioned earlier, if you have people on a gluten-free diet, you may be pushing them into selenium deficiency, and you may be actually affecting their innate as well as adaptive immunity. And it's very, very strong. And once again, as I mentioned, with immunoglobulin or antibody production. So if someone is low in this, it can be more prone. Thyroid patients have a tendency to be selenium deficient. And once again, so if you're dealing with a thyroid patient, you really want to know what their selenium status is. And once again, that will enhance it. So one of the things, of course, and this is one of the things that got me into this field of nutrition, was being an athlete, is we always say, well, isn't exercise good for us? I mean, if we exercise, we should increase our health, right? And most people that exercise, not everybody, but most people that exercise are a little bit more conscientious about their diet too, as far as what they're putting in their mouth and so on. But is there a point where too much exercise can cause a problem? And the answer, of course, is yes. Now, if you look back, way back in Hippocrates, he even noticed the same thing. He made the statement, if we could give every individual the right amount of nourishment and exercise, not too little or not too much, we would have found the safest way to health. And that's right, it's balance, okay? So I treat a lot of marathoners and triathletes and so on. And they don't get sick now, but before I started seeing them, they would get sick quite often. And they said, well, I don't understand. I eat probably better than 95% of the public out there, and I'm getting sick, and I'm exercising and so on. Well, there's some research out there that's been around for years, and this is what we call a reverse J or inverted J. And you can see here, if you look at the middle of the screen, it shows the infection risk and the immune function. And if you look at the bottom of that graph, it shows low to sedentary, active to moderate. And then when you hit heavy intensity or elite, where your immune function actually goes down and your infection rate actually goes up. You say, well, wait a minute. I thought exercise was good for me. Well, I'm going to show you why that actually happens. There's several reasons why it happens, and I don't have time to discuss all of them, but I'll show you from a nutritional standpoint why we see it happening. I mean, I have people that are marathoners that have 2.5% body fat, and all of a sudden they develop diabetes. And their endocrinologists that send them to me say, this guy should not be diabetic. I mean, he's got low body fat, he exercises all the time, he eats healthy. Yeah, but you know what? There are deficiencies that he developed with that intensity that caused him to get an autoimmune diabetic status. And once again, we're finding that out. Now, the microbiome, we know the microbiome has a huge impact, of course, on our immune system. It has a huge impact on our brain and other systems, our respiratory system, our skin, and so on. And these are showing you some of the things that benefit when you exercise, some of the good and bad that can happen when you exercise. And if you don't have the right nutrition, once again, it's going to make it worse. We know that heavy exercise changes the microbiome. It changes the different type of bacteria in our GI tract, which can actually cause increased chance of leaky gut syndrome, or cause more damage, or cause SIBO and various other things. If we don't have the right probiotic, or if we don't have the right vitamin or mineral, and this is once again going to back where the importance of several nutrients together. Vitamin D status. If you have a poor vitamin D status, you can actually have a bad microbiome, even if you're taking a probiotic. If you have a low B2, that may also not allow you to make certain bacteria in our GI tract that keeps you healthy, keeps you away from certain conditions. And I'm going to show you that in a second. So the point is that you can be taking a very good probiotic. It may not be strong enough for you if you're an athlete. It may not be the right one. You may be deficient in certain vitamins or minerals or other constituents that aren't allowing that to happen. You're not maintaining your microbiome. And then people get sick. And once again, you can see that this was a study in 2019. So let's talk about stress. I always tell patients there's two types of stress. There's psychological stress and there's physical stress. And you can have both. And sometimes people that have psychological stress go, man, I'm going to go to the gym and work out 6 days a week because I'm going to burn off my stress. Well, in essence, you may actually be putting more stress on you and causing problems. Now, one of the nutrients that gets affected with stress, whether it's psychological stress or physical stress, is you can see glutamine. And glutamine is huge in two areas of the body primarily. It's high in the skeletal muscle and it's high in the digestive tract. So when glutamine gets low, you then start to damage muscle or you start to damage your digestive tract. But one of the things that happens, and this is kind of a nice function of the body, as we start to exercise, some of the glutamine comes out of the muscle and goes into the blood and actually supports the lymphocyte. And by doing that, that's where we think the light and moderate exercise actually enhances the lymphocyte function and makes it really good as far as efficient, and it prevents you from getting sick. But if you keep exercising heavily and you keep depleting that glutamine from skeletal muscle, and now you don't have enough glutamine to maintain your lymphocyte, now you start to get sick. And that's why we have found that people that have high intensity of exercise have a higher incidence of upper respiratory infection, is because it's one nutrient. Now, most people associate that with vitamin C, but once again, it can be other nutrients as well that come into play. But the point is that here is one nutrient, it's an amino acid, it's very important for a few systems in the body that can put us into this situation. And you can see here, it's the most abundant amino acid, is what we call a conditional essential. We can make this in the body, but under certain conditions, psychological stress, physical stress, surgery, things like that, we can't make it fast enough to maintain our immune system or to enhance our healing and so on. So once again, this is why it's very important that when we have someone that's maybe under a lot of stress, or someone that's exercising regularly, or someone that's going through surgery, that this is a nutrient that we consider. And this has been known for years. Like I said, I've been in this field for over 40 years, and we used to use glutamine. I was a dietitian in the hospital. We used to use glutamine all the time in the hospital and TPN solutions and enhance people or enhance their healing process when they came out of surgery and so on. So once again, very important. Here shows you once again, some things as far as production and utilization of it and where this particular amino acid goes to. And once again, if you are under a catabolic state, you're in a bad situation. And once again, the skeletal muscle is one of the major players of this, along with the digestive tract. But once again, the liver comes into play as well. The lymphocytes come into play, the overall immune system comes into play. If you listen out there, not a lot of people are talking about glutamine in the immune system, even though they should be, because once again, it's very important for the lymphocyte. So as you know, when we're under stress, we kick in this axis called the HPA axis. And once again, the Hypothalamus-Pituitary Axis. And of course, one of the things that happens when we're in the fight mode, of course, cortisol levels go up. We increase our chance of pro-inflammatory cytokines, as it's listed here. And over time, this chronic inflammatory process causes problems. It taxes our immune system. Our immune system has to try to decrease that inflammation. And so this is where psychological or physical stress comes into play. Well, if you're low in certain nutrients, is it going to make this worse? Absolutely. For example, to make cortisol, we need B5, we need pantothenic acid. And so the more that an individual is in the fight mode per se, the more likely that person is going to be pantothenic acid deficient. And that's why we actually nickname B5 as the anti-stress factor. Now, I see a lot of pantothenic acid deficiencies in athletes. I would say probably 95%, unless they're taking quite a bit of supplements before they see me, 95% of my athletes, when I first test them, are low in B5. And it makes a lot of sense if you go back to physiology here. Now, what's also interesting is that B5 helps make the phospholipid layer of our cells. So it helps the barrier. We talked about barriers. It also helps with acetylcholine. And so it modulates our peristalsis. So this is one of the reasons why when people are under stress, if they go, oh yeah, my irritable bowel syndrome always gets worse when I'm under stress. Well, yeah, because you deplete yourself of that particular problem. If you go into the sports nutrition literature, you will see that a large portion, about an average of 50 to 55% of your elite athletes have GI problems. You say, why is that? Because one, heavy exercise causes microbiome changes. Heavy exercise depletes vitamin D. Heavy exercise can deplete B5. I mean, it goes on and on and on. And so these signs and symptoms these people are developing, they're questioning why is that when they so-called eat healthy and they're an athlete? It's because of things like this. Now, what's really interesting is if you have a zinc deficiency, and I have a whole lecture on stress, but this is just parts of it. If you have a zinc deficiency, you can't really shut off that HPA axis. So internally, you are burning a candle on both ends. From the outside, you may look very calm and everything like this, but once again, you are in a bad situation. And this has been known for years. You can see, I mean, some of the citations is early 2000s that we discovered this. And this, once again, puts us into this situation. So when a person is under stress, what often happens? They get sick. Well, yeah, because often those people have a zinc deficiency, which doesn't allow them to make antibodies, or doesn't allow them to have a good functioning neutrophil or macrophage or whatever. And it all comes around here. And so you hear these people now, because we're talking about COVID, that people get sick and they go, oh, I'm depressed. I'm getting more depressed. Well, are you depressed because you are sick, or are you depressed because you're zinc deficient and zinc helps make serotonin, which helps you feel better? Or are you in a situation where you start to have high blood pressure problems because you have zinc deficiency? Because zinc also plays a role with, once again, aldosterone and angiotensin 1 and 2. So this is a very interesting study. They looked at zinc in COVID-19 patients, and you can see this was published in January of last year. And you can see the ones that died had a very low zinc level. Now, this was serum zinc, so it's not even that sensitive like looking at T lymphocytes, but it's important that we look at. Discharge, the zinc was much higher, and you look at the control, and they had good zinc levels. So this is, and as you know, when we look at probabilities, we want at least a 0.05. Well, this is a 0.001. So this is a good indication on how important zinc is with the immune system. But once again, zinc can get depleted with other situations. Now, this was a citation from Galloway and Associates in 2000, where he looked at C-reactive protein levels. And you can see in mild diseases, C-reactive protein levels might be around 15, and there's about a 10% decrease in zinc. And once again, they looked at serum zinc. In severe infections, when they see CRP levels reaching 100 to 200, you see a significant decrease in zinc levels. So this is a whole inflammatory, anti-inflammatory capability. And this is just one nutrient. I mean, CoQ10, vitamin C, several nutrients have anti-inflammatory effects, but this is a good correlation where we used a standard test, a C-reactive protein, and they looked at mild to severe deficiencies. Now, if you go into the literature, and you can see this one of the citations in 2019 here that I put, look at the prevalence. Study report the prevalence of vitamin D insufficiency to be around 48%, almost 50% in outdoor athletes, 80% if these athletes were indoor, basketball players, volleyball players inside or whatever. Think about that. Somewhere between 50 and 80% vitamin D insufficiency. Now, insufficiency, as you know, in the serum is less than between 20 and 30. If you're less than 20, then you're considered vitamin D deficient. But the point is that this is huge. And you can see here, as I mentioned, the African Americans, Hispanic, and people like that have a higher incidence of vitamin D insufficiency. Now, the other thing that's important is not just vitamin D3, but taking it with K2. Well, a lot of companies out there provide vitamin D3 and K2 together, but this is something I want you to really think about and remember. Besides fermented foods that contain vitamin K2, our microbiome is substantial in the importance for making K2. So when you see a K2 deficiency or you're looking at K2 deficiencies, you have to think about the microbiome. And as I mentioned earlier, vitamin D affects the status of our microbiome. Now, another thing that we've found, of course, with the athletes, and I see this a lot through objective testing, is that exercise has a tendency to lower CoQ10. Now, once again, if I would have gave you a little questionnaire at the beginning and said, which nutrients here do you think have a big impact or have an impact on immunity? Most of you wouldn't talk about CoQ10. Most of you would say, oh, CoQ10 is for the heart, for the brain, for the skeletal muscle. But look at this. They have found that in several of these studies where the supplementation or evaluation of CoQ10 affected a person's inflammatory markers like the pro-inflammatory cytokines, okay? Whether it's in junior athletes, whether it's kendo athletes, but you can see in swimmers. So once again, another nutrient that does that. Now, like I said, I don't have time to discuss this because of limited time, but there's some studies showing there that CoQ10 out there affects the pH of our cells or constituents in our cells that actually affect the way COVID replicates or survives. So if you have a CoQ10 deficiency, your pH of certain products in the cell can be affected once again for that. Now, once again, moderate and heavy exercise. Yes, go out and exercise. If you're going to be a person at a marathon, triathlon, you're going to do heavy exercise, you need to support your body nutritionally. It's not just with a healthy diet. Like I said, I have not seen any high elite athlete be able to maintain normal nutritional status on just diet. I have not seen in 41 years, never. They need at least one or two. Now, let's go to medications. As I mentioned, these are just a few medications. As you know, the PPIs are used a lot for GERD, ulcers, H. pylori, so on. And you can see here that we have actually found that when you have a usage of PPIs, that you increase the risk of enteric infections. Now, if you go into the literature and follow how PPI should be used, this is what it says. You take them for 4 weeks, you try to do dietary changes, maybe weight loss, things like that, and then reevaluate. If that didn't work, then you do it for another 4 weeks. If that didn't work, then another 4 weeks. So they usually talk about a 12-week period. You know as well as I do, and some of your patients may be on them, and you might have prescribed them. They've been on for 6, 7, 8, 10, 15, 20 years. When you do that, you're changing the microbiome. You are setting people up for situations down the road, whether it's SIBO, whether it's Clostridium, whatever the situation is. Now, there's other things like antibiotics, antidepressants, statins. All of those have been shown in independent studies to change the microbiome. So we might have a patient that's on a PPI. Well, they might have an H. pylori, so we know they're going to go on an antibiotic. And they might have heart disease, so they might be on a statin. So now you're compounding all these medications and you're changing the microbiome. And once again, the microbiome has been shown to affect the respiratory system, or every system in the body. So once again, this is something you have to consider. So I truly believe there's really 3 phases of health. This is a little different than what I think, but this was published in Nutrients in 2020. And they talked about death, severe clinical deficiencies, marginal subclinical, and of course, optimal. I look at health as 3 ways: optimal health, average health, whatever that means, right? And poor health. And I truly believe, until we get a hold of our patients, that most of our patients are in average health or at the bottom of average health and right going into poor health. Well, if they sit there for a period of time and something comes up, viral infection, bacterial infection, psychological stress, physical stress, they're going to drop into the poor health status, and they're causing more and more nutritional deficiencies. If we push people all the way up to optimal health in regards to micronutrients, the chances of them having problems, turning on genes, getting sick real frequent, having headaches, having other issues, is going to go down drastically. And that's what it's all about, is preventative and being proactive versus reactive. And as I mentioned on the very first slide, that the doctor of the future, the clinician of the future, is going around to the very beginning of Hippocrates, or needs to be, saying we need to look at diet, we need to look at exercise, and we need to look at micronutrients or specific vitamins and minerals. And if we do that, a lot of conditions are going to be decreased, frequency is going to be decreased, and I think severity is going to be decreased. I know it will be. I see it all the time where people come in, they're sick 2 or 3 times a month for years. We get treating them, and now they win attendance awards at their school, or they get sick maybe once every 2 or 3 years now. It's not by chance. It's feeding the body what it needs specifically for that individual. All right, Alyssa, I'll open up to some questions that people may have.
Thank you, Dr. Grabowski. We just have one question tonight, and that is, how do environmental toxins affect micronutrient outcomes on SpectraCell testing?
Well, environmental toxins, of course, are going to cause free radical production. And when you have free radical production, you're going to have increased requirements of antioxidants. When you have increased need for antioxidants, then of course, depending on the antioxidant, whether it's zinc related or selenium related or so on, you're going to cause those to go down. And of course, you're going to affect your immune system. There's studies, of course, you're probably all aware of this, mercury. Mercury causes a substantial impact on our body from a free radical standpoint. And so when people have mercury toxicity, same thing. People get exposed to molds, things like that. The body has to try to clean up those systems or try to neutralize those systems. And what we see with SpectraCell testing is their antioxidant status, which we name as a Spectrox, goes down. And then when you look at that Spectrox that's abnormal, of course you say, okay, what specific antioxidants are required to correct that? I might have 10 patients that could be exposed to mold, and all 10 of them have different antioxidant statuses. So do I give all of them vitamin C? Do I give them all zinc? No. Some may need vitamin C, some may need zinc. If you, and this is a famous, kind of a common saying when I lecture to clinicians out there, is if your car needs gas, don't give it oil. You need to give it what it needs. And there is no way, and I've been, like I said, I've been doing this over 40 years, there's no way you can do that and know without objective testing. Otherwise, we're guessing. We're saying, oh, take zinc, see how you feel, take C, how you feel. No, why do that? Why would you want someone to do that with you? No, of course you would. And so I think that, and the public's getting very savvy about that. They're realizing that there's testing out there that's very beneficial. Like I said, I've been using SpectraCell for over 25, 26 years, and I can show you correlation after correlation with pathologies and how it matches up with the scientific literature. So the point is that let's address that. Let's be proactive versus reactive and see what we can do for the public out there. And I really think if all of us address it more, people will have less issues with COVID and other infections or other immunological problems. And the T lymphocyte is such an important cell in our body. And once again, I showed you just a small amount. I was telling Alyssa earlier that I have 800-900 slides just on immunology and micronutrients. And of course, there's no way I could present all of those tonight. But the point is that there's a lot of information that some of the researchers have done at the beautiful work. And we need to grab that research and utilize that with our patients.
Thank you, Dr. Grabowski. Well, that concludes the presentation for tonight. I don't think there are any, oh, one more question. Vitamin D sequesters in the fat tissue. Obese patients often have low vitamin D, but how do you know the vitamin isn't just sequestered in the fat and there is a danger of overdosing?
And that's a great question. One of the things, like I said, SpectraCell looks at the T lymphocyte and we see that correlation. The other thing that's important to look at is some of the signs and symptoms. Vitamin D toxicity or adverse effects per se almost presents like a diabetic. They get real thirsty, they urinate a lot, they usually get generalized muscle pain, and they usually get frequent headaches. I'm not talking about one headache a week or one headache every 2 or 3 weeks. I'm talking about daily headaches. So when you're looking at vitamin D toxicity or adverse, is those are the things you look at. They almost present like a diabetic. And that's one of the things. Now, of course, the only other way we do it is we'd have to go and do some, biopsies of the fat tissue. But Yes, that's one of the things that we look at. But the other thing, as I mentioned earlier, look at the B2. Are we looking at the B2? And even some of the best institutions out there that are known for doing good research, I'll read their literature and go, wow, you didn't look at B2, you didn't look at K2, you didn't look at magnesium. And so they're making these conclusions on one nutrient, but they haven't evaluated the other ones that are closely associated with that. So I think that's also something we're going to see down the road. And then, of course, there's genetics involved and all that. But yeah, I mean, the stature of somebody like an obese person is going to be more prone to sequestering vitamin D. Now, of course, we know vitamin E doesn't last very long. It has a very short half-life. And vitamin A, of course, a lot of people stay away from. But the same thing is true with those fat solubles. Just like I said, zinc and copper compete. High amounts of fat soluble nutrients will compete with other fat solubles. So if you're giving a large amount of vitamin D, who knows if you're pushing someone to vitamin A deficiency? You're not going to know that unless you, once again, do some objective testing.